moving on to geriatrics. So for your geriatric component of your competencies, your patient must be 65 years of age or older. They also need to be either physically or mentally disabled. So they need to have had a stroke, experiencing dementia, a trauma, contracted, something like that. You have geriatric chest. This patient must be in a stretcher. Upper extremity for geriatrics can be anything that you can get. The lower extremity for geriatrics is a stretcher foot. So we're going to use some angles on that. Some quick tips for taking care of the elderly. Take the time to educate both the patient and the family. This decreases patient stress and anxiety, increases their compliance and their satisfaction. Speak lower and closer, trying to reduce any background noise going on around you. Take them into the room, close the door. Treat them with respect and dignity. Communicate with warmth, empathy, and a positive attitude. Do not use honey or dear to refer to patients, to elderly patients or geriatric patients. Okay, use their name, Mr. or Mrs. Smith. Treat them with respect. Okay, provide some rest time. If they have multiple exams that they need done, ask them if they need a break in between. They're going to be a little afraid, most likely, of falling off your table. If they are on the table, reassure them of that. Avoid using any adhesive tape with your geriatric patients that can easily cause damage to the skin or a skin tear. Use the table pads and handrails, increases their comfort and compliance. Use some blankets, sponges, whatever you can use to help assist you, to help them hold in a certain position. And then check your patient history before any contrast administration. This will help reduce any adverse reactions such as dehydration, induced kidney failure, assess for swallowing difficulty, if they're at risk for aspiration, anything like that. Your geriatric patient that needs a chest x-ray, they may arrive in a wheelchair. They might not be steady enough to stand, so we'll make it work. They can sit in the wheelchair, we'll slide it right behind. If these rails come off on the sides, you can take those off, slide them right up against the wall stand, and take your lateral that way. Upper extremities, utilize what you have. So she's using a sponge here to support to do a hand. She has a rolling tray. Feel free to keep them in the wheelchair. Our wall stands drop down flat. So in miscellaneous, just drop your wall stand down. Don't make them transfer into a separate chair. He can stay right in his wheelchair. Try and bring everything to them whenever possible. So trying to get these stretcher feet is definitely a little bit more difficult. You're going to have to utilize some angles. So this foot here, they have propped the foot up. The cassette's at an angle, and they're angling their tube to compensate for that angle as well. And this is a cross table foot. This technologist is trying to get a lateral hand, so they're utilizing multiple sponges and some angles. So we might have to think out of the box on these. Technical factors. They may need to be adjusted to accommodate disease and normal age-related issues or changes. So just be aware you can usually use lower technique, especially on your geriatric females. For wrist x-rays, you can usually lower the kVp if they have decreased bone density. Shorter exposure times are always going to help reduce your risk of getting motion on your image, right? So they have a hard time sometimes holding their breath or holding still. Breathing instructions, just be very careful, communicate in basic terminology, straightforward. Adult bone surveys, we call them MET series. They're looking for metastatic cancer. So in metastasis, the cancer cells break away from where they were first formed. So wherever the primary cancer was, they travel through the blood or lymph system and form new tumors in other parts of the body. The metastatic tumor is the same type of cancer as the primary tumor. It's just in a different location now. Some types of metastatic cancer can be cured with treatments, but most cannot. And these are just some x-ray examples of some metastatic cancer that you might see. This breast cancer has metastasized here. Cannonball metastasis is actually colorectal cancer that ends up looking like this up here. Lung cancer, metastatic with extensive bone destruction. So can you see these sort of darkened circular areas? It's literally sort of eating away at the bone here, but it's lung cancer actually. Breast cancer that can metastasize to the lumbar spine. There's white vertebrae right here. It's metastasized there. Geriatric fractures. So with age, the bones lose their mineral content and become weak. They're prone to injuries with really minimal trauma. So a fall that I could take or you could take wouldn't cause a fracture necessarily, but in an elderly patient whose bones are weaker, a small fall or even bumping into something can cause a fracture easily. So most common areas are ribs, distal radius, hip, proximal humerus, and then compression fractures. So we've gone over compression fractures before, but obviously the compressed vertebrae is where the compression fractures are. And these aren't necessarily just from a fall. We've had patients that have coughed too hard and caused a compression fracture. The Coles fracture, it's the fracture of the lower end of the radius in the wrist with a characteristic backward displacement of the hand. So forearm here, hand is pushed backward. This is usually that fall on the outstretched hand, right? Or they call it a dinner fork deformity, as this. So this patient, you would most likely do a PA wrist and a PA forearm. I wouldn't transfer this patient AP forearm, something like that, okay? And I would shoot cross table lateral for this. Proximal humerus fracture. They fell either sort of on their arm or on their elbow maybe, or on the shoulder itself when they fell. And fracture here is in sort of some multiple pieces. This last image here is of new bone, and depending on the age, they will not do surgery on this, depending on the age of the patient. Osteoporosis and osteopenia, you'll see these terms here and there, mainly in the bone density room. You'll see those the most, but osteoporosis, it's a condition where the bones become brittle and fragile from loss of tissue. It's usually deficiency of calcium or vitamin D. Basically, osteoporosis, osteopenia, the bone loss is not as severe as osteoporosis, but they can still fracture a bone. So they may have a harder time moving for you, less range of motion. Their bones are not going to be as dense as yours or I would. Okay. Osteoarthritis is common joint disease that most often affects middle-aged to elderly people. It's usually wear and tear on the joints. It involves the cartilage, joint lining, ligaments, and bones. So you'll see here, this is a really bad arthritis hand. They're not going to be able to get in that perfect fan position for you, or that oblique maybe. So you're going to have to work with that patient, okay? Pelvis, for question hip fracture. We get a lot of elderly patients who fracture the femoral neck, right? It's the weakest point in that femur area here. It's usually right in here that they fracture, right? So when you take your pelvis to start, because you will always start with your pelvis on your ER patient, elderly patient, that they're questioning a pelvis and a chest. You will never sit them up for the chest first. You're always going to do the pelvis first, right? And see if they're fractured. So obviously there's a fracture here in the hip. You're doing AP of that. But are you going to frog that elderly patient with the hip fracture? No, you are not. You're going to shoot through. You're going to do that cross table hip, right? That Danielus-Miller method to get your lateral hip that way, right? So you're going to raise the unaffected leg, keeping the leg of interest straight down. You're either going to use the cassette holder or the rolling cassette holder that we have in the ER and slide it up against the patient. You'll angle your tube in this direction here, in between the legs, and line it up to your grid cassette. Hip prosthesis dislocation. A lot of your elderly patients have had hip replacements before, and they can dislocate. So obviously this one is not in its socket, right? So you're going to use that same method, you're going to start with your pelvis. You do your AP hip if needed, and then you're going to do that cross table lateral image again to show them where it is so they can pop it back into place. And that concludes my geriatric.